Hi, I'm Allie Ward, Editorial Director of Contagion, and joining me today is Dr. Thomas File, President of the Infectious Diseases Society of America and Chair of the Infectious Disease Division and Co-Director of the Antimicrobial Stewardship Program at Summa Health in Ohio. Dr. File, thank you so much for joining us. Let's jump right in today. IDSA has really been at the forefront of this COVID-19 pandemic since the beginning, continuously setting and updating guidelines, as well as weighing in on some of the debate surrounding aspects of public health's management of COVID. Can you talk a little bit about the role of IDSA in this pandemic?
Well, thank you, Allie, for having me. And sure, I'd love to do this. I mean, as you can appreciate, all of our members and our staff have been working tirelessly, almost 24/7 on this pandemic for the last 6 months, really. I mean, I can remember very vividly getting a email on January 21, actually, from one of our ID colleagues who's a member of IDSA, who had just admitted at the time, actually, the first patient with COVID-19 or infection due to SARS-CoV-2 to a hospital in Washington. And of course, that started multiple patients that we've seen since then. But literally, since then and into February, our volunteer members of IDSA, our staff of our association have pivoted away from non-COVID activities to almost 24/7 working on COVID. And as you said, we've been working almost on all aspects. I mean, many of our members are involved in research, actually for antivirals, for developing vaccines. I mean, we've been working very hard in the public health sector. Many of our members are public health experts. We've been working very extensively in education, educating the public, educating our colleagues, but most importantly, actually taking care of patients. I mean, you know, we have a membership of over 12,000 infectious disease specialists and scientists and researchers and public health experts and other public health or other health professionals, all involved in the care of patients with infectious diseases. And basically, we've all been working on this COVID pandemic since that time. Now, as you mentioned, our society has done many things on our website to develop protocols, to develop policies. We've developed a variety of telebriefings to help educate the public and the media. We've developed very significant rapid guidelines for our members and for everybody else caring for these patients. I mean, we have guidelines for treatment, management and treatment, guidelines for infection control, and guidelines for diagnostic testing. And these are live guidelines. I mean, they're living documents, so that we're changing them, and we're already updating the management and treatment guidelines as we see new information coming together. I mean, we've been having significant communication with government, with policymakers, both national and the state and local level, to make sure that we're getting the best information so that our patients are being appropriately treated. We're working very closely with CDC and NIH. We've developed a learning network with CDC. So as you can see, I mean, our society has been very active. We're working very tirelessly, but that's our mission. I mean, we want to make sure that we provide the best care for our patients. We all have to collectively work to respond appropriately to this pandemic.
Absolutely, definitely a collaborative effort. And you just touched on it in the live document guidelines that you were creating. I mean, how challenging has it been to keep up with just the sheer volume of news and data regarding COVID that's coming out?
Yeah, Ellie, that's absolutely appropriate. I mean, almost there's new information daily. And it's really important that we have accurate information and not misinformation, unfortunately, which can sometimes happen, particularly in social media, and be disseminated. So, and as you're even aware, some of the studies that have even been published had to be retracted, because we have to just make sure that information that is being disseminated is appropriate and that it is the best for care of our patients. And so it's vital that we all have sources of very accurate information. Obviously, IDSA has a very active website. We have a COVID resource center there that has all kinds of information. There's a directory, whether you want to go to various guidelines or if you want to go to protocols from other institutions to see how they're handling PPE and contingency assessment. There's, as I said, telebriefings, there's podcasts. We have blogs on our website. So we have all kinds of sources of information that can be accessed through our website, which is idsociety.org.
Great. The FDA has been moving just as quickly, and last week actually revoked the emergency use authorization for hydroxychloroquine and chloroquine. IDSA put out a statement supporting that decision. Can you talk a little bit about coming to that decision?
Well, again, if you look at the FDA site, I mean, they indicate that their decision was based on new information, which suggests, and we agree with that, that suggests that there's really no significant benefit of these two drugs in patients who are infected with SARS-CoV-2 or who have COVID-19. And you're probably aware, Ali, that literally in the last week, two very large studies, and I'm talking about tens of thousands of patients that are enrolled in these studies. One is a recovery study that's overseen by investigators in Oxford, England, and then the Solidarity study, which is overseen by the WHO, both suspended or halted recruitment into studies where they were evaluating hydroxychloroquine. Why? Because in their assessment, they really did not find any benefit. And then also there was a study that was published out of the University of Minnesota showing that patients who were exposed to COVID-19 and then given hydroxychloroquine really had no benefit in preventing infection. So we have robust data now which suggests that there just isn't a significant benefit at all of hydroxychloroquine. So it certainly was our assessment as well, IDSA, and we're going to be showing that in our updated guidelines as well, that there's really no benefit of these two agents.
You mentioned Oxford. We did get some news this week out of the UK that investigators there had seen some success with a cheap and widely available steroid in terms of reducing mortality in patients with COVID-19. What was your reaction to that news, and do you consider that agent a viable treatment candidate?
Well, anytime we get good news and there's data that suggests that there's interventions that can be helpful to our patients, we certainly welcome that. And again, this is from the same adaptive study that I just mentioned, that recovery study that's overseen by investigators in Oxford, England. But that study, and again, this is a preliminary report. We haven't seen the published data, so we have to really look at the published data. But it's the use of dexamethasone, particularly in patients who are fairly severely ill and have significant illness, often requiring mechanical ventilation. And that's important because up until now, there's been a question about, what interventions can be valuable in these patients who now are to the stage where now they're on the ventilator, perhaps developing an ARDS. And so the fact that there's this study that suggests that there's benefit is very helpful. We still have to wait to see the peer-reviewed published data, but I'm certainly encouraged by this initial information.
And switching gears to vaccination, have you heard any news that you're similarly encouraged by on the progress being made on vaccine development for COVID?
Well, right. I'm encouraged by that as well. I'm a very optimistic person, actually. And at least when I hear about the progress that a variety of investigators and developers are having with their development of a specific vaccine, and there's several that are in evaluation right now, different platforms for the vaccines. I'm encouraged because it looks like they're going to already be starting phase 3 studies next month. And hopefully these can be geared up and show definite benefit and be shown to be very, very safe. So what's the earliest that could be available? I don't know. I mean, people say possibly by the end of the year. I think that's very, very optimistic. But certainly if we can get it within a year, I mean, from the standpoint of vaccine development, that is very, very quick. And it's really going to be important because until we can have a vaccine and therefore have a large segment of the population receive this vaccine, therefore have herd immunity, it's going to be very difficult to control this pandemic.
Absolutely, great point. From your perspective as an infectious disease clinician, what has been the biggest obstacle in navigating this pandemic?
Well, that's a good point, Ali. When I think about that, there's probably several. I think right now the biggest issue is what I'm going to call, and what others have called, maybe COVID fatigue. I mean, so much of the population, they were at stay-at-home mode or shelter-in-place mode for a couple months. Now the weather's nicer. I mean, communities are opening up, restrictions are reduced, and people are outside. They want to perhaps remove their masks, forget about social distancing, and that is not good. That's going to jeopardize being able to safely open up the community. So I think we have to provide a good guidance that when we're opening up, we still have to practice these good health measures, such as physical distancing, such as wearing masks, such as hand hygiene, such as disinfection. That's extremely important, or else we're going to jeopardize opening up the communities. We've already seen, and I'm sure you're aware, that some states have seen a significant spike in cases as they're opening up. And that's the worst that we could see if we have to lock down again, and we don't certainly want to do that. So I think what I'm going to call COVID fatigue is a big issue, and we have to try to, maintain good practices and promote this to the general public. I think other issues of concern is we still probably don't have adequate testing that we need, because until we can have adequate, easily accessible testing, and then you can do contact tracing, so we can go back into this mode of containment, so that we identify patients, we identify who's in contact with them, we can quarantine them or self-monitor them so that we can contain further transmission. That's going to be extremely important. And then from a standpoint of workforce, I'm going to say some barriers that we just don't have enough of us. We don't have enough of, public health experts. We don't have enough of people that actually are going to be required to do the contact tracing. There's one study that suggests we probably need at least 300,000 in the United States to do that adequately, and we just don't have that right now. So we have to ramp up, and this is a potential obstacle if we're going to be able to continue to contain this pandemic as best as possible.
Right, absolutely. And you mentioned some of the spikes in areas that are, in the further stages of reopening, but there are also concerns about, this second wave, especially as we approach fall and the start of flu season. How serious could this second wave be, and what can clinicians do to ensure the public is aware of this threat?
Right, Allie, and I think that's a great concern. I have to, there's many potential scenarios of what's going to happen with this pandemic, but I have to think that the most common is that we're going to continue to see low level of activities, maybe general occasional spikes as we go through the summer. But then the great concern is that when we go into the late fall, early winter, the respiratory season, we're going to see another surge. I mean, if you look at the history of pandemics, that's what's happened. I mean, even the 1918, 1919, even the 2009, 2010 pandemic with H1N1, it started in the late winter, early spring, but then the next winter, it was even worse. And so we have to be concerned about that. And then, like you said, I mean, if this occurs at the same time with influenza, it could even be worse, because we do know that dual infections, even dual viral infections, can be associated with greater morbidity and unfortunately mortality. So what should we do? Well, we have to be prepared for that. And at least hopefully we'll have some antiviral medicines that we've already mentioned. But again, we're going to have to be very, very stringent on maintaining the health measures that I've mentioned and using the masks. I mean, when people go back into colleges and to businesses or whatever, we're going to have to wear the mask. We're going to have to physical distance as best as possible. The hand hygiene. So we're just going to have to be very aware of that and promote that as best as possible until we have that vaccine.
Right. And my last question is, what is your message, your advice to your peers and colleagues in infectious diseases during this time?
Well, you know, those of us in infectious disease, I mean, we've been working tirelessly 24/7 to control this pandemic. And I'm so proud of all my colleagues who are doing this, and many cases even putting their lives at risk, their families at risk, but they're doing this because they know that this is best for the community, this is the best for their patients, this is our mission. And so I'm very proud of all of my colleagues that are involved in this case against this pandemic. And collectively, let me just say this, if we all work together, we are going to get through this. And so thank you, every one of you who are working tirelessly to manage this pandemic.
And we thank you, Dr. File, and all of your work with IDSA. Thank
Well,
you again so much for joining us today. Is there anything else that you'd like to add?
No, that's fine, Ellie, and thank you for having me.
Thanks.